Hi, everyone. I'm Dr. Arturo Loaiza Bonilla, practicing GI medical oncologist and director of research at Cancer Treatment Centers of America. I have the privilege to be part of the ASCO Highlights 2021 and provide also the updates on the gastrointestinal cancers, colorectal cancer updates on the abstracts presented at ASCO. So one of the few things that you may know is that there was a lot of data presented this year, but many of them were updates, right? So the first one that I wanted to mention is the Keynote 177. So this is for patients with metastatic colorectal cancer in first line who were treated with either pembrolizumab or chemotherapy when they have MSI-H status. So in the past, we know that FDA approved pembrolizumab, but we want to have an update on how these patients fared after, first-line treatment. There was a difference in progression-free survival too, and also the safety profile. And what the updates showed is that pembrolizumab was confirmed as a standard of care in first-line treatment for patients with MSI-H colorectal cancer, showing not only superior progression-free survival, but also improved quality of life and less adverse events compared to chemo. So basically, we should continue to use pembrolizumab in these patients in first line. The other update we had is the Trustee Trial. So Trustee Trial was basically trying to see if the combination of trifluridine tipiracil plus bevacizumab in second line of metastatic colorectal cancer patients had a role. And why? Because we had that option in the NCCN guidelines for for the third line, and there's some data in first line, but we didn't have anything in second line. So they wanted to compare it to either any form of fluoropyrimidine plus irinotecan plus bevacizumab in that setting. And what it showed is that, unfortunately, there was a worse safety profile, and there was not really a non-inferiority here. So we should basically stick to fluoropyrimidine, irinotecan, bevacizumab in our patients with second line if we want to use it, and spare the fluoropyrimidine, tipiracil, and bevacizumab where the data is, which is basically in the third line and beyond. The other update that we had was from the FIRE 4.5 trial, or the AIO KRK-016 trial, which showed that basically FOLFOXIRI plus cetuximab was compared to FOLFOXIRI bevacizumab in patients with basically first-line metastatic colorectal cancer who were BRAF V600E mutated. So basically very, very specific subset of patients. And basically what it shows is that basically FOLFOXIRI bevacizumab was more preferred for patients with RAS wild type BRAF mutated colorectal cancer in terms of some outcomes, including progression-free survival, and also safety profile, as we all know. We're very familiar with that. The other trial that we discussed was the Focus 4N trial from the UK, which is trying to answer the question in a patient with metastatic colorectal cancer who started treatment and responded. What should we use for maintenance, right? So we have some data from the CARE trial where we use fluoropyrimidine plus bevacizumab, but in some settings with bevacizumab can be costly. So they were trying to figure out if they can compare capecitabine only as maintenance versus basically do nothing, just basically follow the patient closely with active monitoring, and found that it was a reasonable option to consider capecitabine maintenance because it doubled the time from the time they should go back to full regimen, not only maintenance, but active combination chemotherapy agents. And the last but not least of the trials that we discussed was the DESTINY-CRC 01 trial, which was a study for patients with colorectal cancer who had received at least 2 lines of treatment and treated with trastuzumab deruxtecan, which is this monoclonal immunoconjugate that targets HER2. So it's basically at a dose of 6.4 milligrams per kilogram every 3 weeks, showed promising activity, with a caveat that it only showed activity in patients with HER2 positive 3+ by immunohistochemistry, and in some patients with 2+ by immunohistochemistry with FISH positive. So possibly that's the next route of approaches in the future for these patients. So a lot of data, a lot of new things coming up. Hopefully you get a chance to attend our updates. They're free, they're easy to access at ASCO Direct Highlights by Total Health Conferencing. Once again, I'm Dr. Arturo Loaiza Bonilla from Cancer Treatment Centers of America, and thank you for your time today. Hopefully we see you again soon.